wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. We're going to visit with you about why in society today more individuals, as they mature, are looking for alternative and natural approaches to obtaining and maintaining health and wellness naturally. As we mature, all of us would like to live longer. We know ultimately we're all going to be faced with death. That's inevitable. But while we're alive, we want to feel alive. We want to have energy, and we want to have vitality, and we want to have enthusiasm for life so we can enjoy and fulfill God's purpose for our life, so we can take care of our families and enjoy our children and our grandchildren and hopefully our great-grandchildren. And we can enjoy our friends and fellow church members, and we can have an exciting, vibrant life. That's what we want as we age. We call that a healthy health span, not a lifespan. We want to be healthy while we're living longer, right? So we don't end up at a nursing home, laying in a bed and nobody coming to see us. We want to be vibrant. As a matter of fact, it tells us in the Bible that Moses didn't start taking the children of Israel out of Egypt until he was 80 years old. And then because of some problems the Israelites caused in being disobedient, God made him wander around for 40 years, and Moses had to lead him. Now, can you imagine if you're 80 years old and you knew for the next 40 years you're going to wander around on the Sinai Peninsula with a bunch of recalcitrant followers complaining all the time? He ended up dying on Mount Nebo across from the Red Sea. God said, you're not going to go into the land because of something Moses had done earlier while they were wandering around. It made God mad and said, well, you're just not going to be leading them into the promised land, but you're going to lead them to the promised land. He died on Mount Nebo overlooking the promised land, Israel, at the age of 120, and it says in the Bible that he was full of vim and vigor, and he had sparkle in his eyes. Now, that would be nice as we mature, whether you're 90 or 100 or 110 or 60 or 70, to be vibrant and have sparkle in your eyes. So when people see you, they go like, boy, you're looking good for your age, or how old are you? You really look good. And so that's the way we want to be. And the aging process is caused by a number of different factors. Primarily, it's the inevitable decline of our hormones as we age, both in males and females. Now, men and women are becoming more and more aware of this because we've got access to information. You've got the internet you can go to, and you can Google anything, and you can find all kinds of answers to your questions. You can research this on your own. As a matter of fact, I read where if you take one topic, I don't care what the topic is, and you spend 100 hours studying that one topic, you'll be in the top 1 percentile of people that know about that subject, and probably higher than that. In the United States, you'd be in the top 1%. Worldwide, you'd be in the top 0.1 or 0.01% if you studied any topic. So you can go and you can begin to look at different approaches to health. And because of what's happened in medicine over the last 50 or 60 years, as the pharmaceutical companies have become more involved in educating doctors, really indoctrinating doctors into the drug model of treating dis-ease. Notice I don't say disease, I say dis-ease. And they offer pharmaceutical solutions for the natural problems and the symptoms that occur as people age. So, as I mentioned, naturally, your hormones are going to decline inevitably. You might go like, well, that's natural for them to do that. Yeah, and you can feel old and funky at 50 years of age and not have any drive or assertiveness or you're depressed and moody, whether a man or woman, it affects both men and women. Women go through the menopause when they stop, when their menstrual cycles pause, they stop, and men go through andropause. Their testosterone levels decline. Other things that inevitably lead to the diseases of aging are the toxins in the environment. All of us are exposed to toxins everywhere, in the air we breathe, in the water we drink. You can imagine this. All the water has to go through sewage process, and it flows out, and they go into sewage processing tanks, and all the effluent from the processing tanks where they try to create new water, when they get new water, they empty all the byproducts into the streams and rivers. And so all the medication that you take, think of all the medication that Americans take. 5% of the world is composed of Americans, but Americans consume somewhere on the order of 80 to 90% of all the drugs that in the whole world. Americans do. And those drugs, as they go through their body, they have to be eliminated either in their feces or usually in their urine, and that goes somewhere. They just don't go away when you flush a commode. They get into the water system. And you can take the water at your home and go do an analysis off a tap, and you'll find all kinds of petrochemicals and fluoride and all sorts of chemicals in that water that you're ingesting if you drink out of tap water. That's why we recommend reverse osmosis or some sort of filtering system for your drinking water. And we always recommend don't drink out of plastic. It's got all kinds of plasticizers and petrochemicals in that water. And you can taste the difference. If you had a glass of bottled water from a stream that's been purified, or just a water in a plastic, if you taste those, and you can taste the plastic in the water. So that's why if you want to cut down on your environmental load of toxins, you've got to replenish your water, and you've got to filter your water, and we recommend reverse osmosis. That's what I have at 2 of my sinks at home, and we also have a filter outside. So we double filter our water as it comes in, because the water's got chlorine in it, and the chlorine and the fluoride in the water adversely affect your thyroid hormone function and the production of thyroid hormones, which govern your body's metabolism. Because thyroid requires iodine. Iodine, if you remember back into your high school chemistry on the periodic table, you have the halogens: iodine, chlorine, fluoride, bromine, and others. And these compete with one another. So the fluoride in the water and the chlorine in the water compete with iodine, and that can adversely affect your thyroid gland's ability to produce enough or the proper kind of thyroid hormone. Besides, the fluoride in the water affects an enzyme inside your cell that converts the inactive thyroid hormone T4 with 4 iodine molecules to T3. It's called deiodinase. It takes away one of the iodines atoms off the thyroid hormone. So it makes the active thyroid hormone T3. That's what has to get into your cell, but fluoride poisons that enzyme, so it doesn't make the conversion. So you end up running on T4, which is very inactive as far as the ability to increase your metabolism. So we recommend that you filter your water. Also, we recommend that you get yourself at your home, get yourself on non-toxic soaps and chemicals. Get them out of the house. Don't have your pest dealer come in and spray a bunch of chemicals in your house. All those get into your body. If you can smell them, they get into your body. And when they get into the body, they localize in your fat, and they bleed out, and they cause a toxic overload, which over time can lead to cancer and a host of other health problems: coronary artery disease, liver damage, urological dysfunctions. So what we want to do is we want to make sure that we keep the toxic chemicals out of our body. Let me give you an example on myself. I did a toxic organic volatile screen on myself several years back, and it said I had styrofoam. I was in the 95 percentile. In other words, only 5%. I was in the top 5%. 95% of the people had less styrofoam in their blood than I did. And I said, why would I have styrofoam in my blood? Well, back in med school, we drank out of, coffee out of styrofoam cups, and that heats up, and I'm drinking that, and I'm getting styrofoam in my system. But I quit that maybe 20 or 25 years ago, maybe 30 years ago. Could have been longer. But every time I go out to the golf course, I get water. And the water's in styrofoam cups. I put the ice in, and I thought, well, it's cold, so the styrofoam is not going to leach out and get in my system. But guess what? It was in my system. Then I read where it's just hard to get it out of your system, and styrofoam is toxic. So I'm toxic. I've got styrofoam in my body. And I can't remember what else, but that caught my eye. So we want to do everything we can. And the other thing you've got to do is you've got to eat organically. Buy organic products. You may spend a little more, but what's your health worth? And they're still cheap compared to going out and eat. If you go out to eat, I can assure you there's all kinds of chemicals in the food that you're eating that are adversely affecting your hormone production. And if your hormones are going to decline naturally anyway, why speed up the process by getting all these petrochemicals? If it's in a bag or a box or even in a can, or you're eating out, or you're getting beef at the store, they load these animals, they get them into the pens and feed them. They're being fed corn. They've been sprayed with glycophosphates, which are highly toxic, and that gets into their system. They're also given hormone shots, and that gets into the system of the animals, and then you eat it, and you're getting what they ate. We highly recommend that if you're going to eat beef, and I eat beef, but I buy beef from a cattle farmer that doesn't vaccinate, and he range feeds his cows, and he doesn't he doesn't use any fertilizer or toxic chemicals on the ranges where he feeds them. So I know they're clean, and you want to eat as clean as you can. So you can read about this online. Take my word for it if you want to, and I would because I've studied this. But if you want to go do your own research, go online and look up Xeno, Xeno estrogens. Look up the adverse effect of toxic chemicals. Find out where they are. You think about all the plastic, I don't like the fact that everything comes in plastic now. You end up throwing it in your trash can. Where does that end up going? Well, in some places, like out in New York City, they dump them out in the ocean. And they say the ocean is filled. I saw somewhere off California where they had dredged the bay, and it was full of all kinds of plastic bags and cups, and you name it, all sort of plastics. And the fish are eating that. And so the fish that we get, they're getting toxic. We're poisoning the planet. Now, I'm not one of these green guys. I do believe, though, that we ought to take care of the environment. We shouldn't be loading it with plastic for crying out loud in a bucket. That's just not good and healthy for you and for our environment. I don't have anything to do with cleaning up the environment. I can't do it myself. I can do it on my own at home. But what we can do, as your hormones are adversely affected, we can balance those out. Women particularly have problems as they march through their menstrual life. They hit puberty, as soon as they hit puberty, they're on a march towards menopause. The hormones that are produced are progesterone and estrogen. Estrogen, they're produced all month long after you stop your period, and they proliferate the inner lining of the womb. Progesterone comes in the middle of the cycle on about day 14 in a 28-day cycle. Midway in the cycle, the ovary will give off an egg, and in that area, it's called the corpus luteum. It produces progesterone, which matures the inner lining of the womb that is being proliferated by the estrogen, and it balances out, waiting for a pregnancy. If there's no pregnancy, all of a sudden the ovaries shut off, slough the inner lining of the womb, and you start over. But as women age, or after childbirth, many women tell me it was after my child, I just never felt the same. And my periods got heavier. I had more cramping or more premenstrual symptoms with mood swings, fluid retention, and weight gain, and headaches, and breast tenderness. And it could be from 1 or 2 days before your period to 2 weeks before your period. It got worse and worse, and the periods got heavier, and they had breakthrough bleeding. They got fibroids. They go to their OB-GYN. I'll solve the problem. Cut out your uterus. Okay, we'll do a hysterectomy. That doesn't solve the problem. Surgery doesn't solve that problem. It stops the abnormal bleeding, yes, but the problem is with the abnormal production of hormones. They can be easily balanced. Progesterone is a God-given hormone, a natural occurring hormone, and we only replenish our guests with the same identical hormones that God gave you to make in your body to begin with. And as they decline, we simply replenish them, get the level back up where you were when you were younger, so you feel rejuvenated, youthful again. And that's what we all want. As we mature, we want to feel youthful. We want to have vibrancy and enthusiasm for life. And that's what hormone supplementation can do. So if you're experiencing problems, ladies, of mood swings, if you're having anxiety attacks, panic attacks, and you've gone to your physician, he says, I checked your blood and your blood's all normal. Remember, over a 28-day cycle, the hormones have big changes, so there's a wide range. And women are always going to fall within this wide range of normal, so you can't make the diagnosis of hormonal imbalance strictly on a blood test. That doesn't tell you anything. You, as a guest or a patient, are the ones that explain to us what your symptoms are. And having dealt with over 35,000 guests in the last 35 years at the Hotze Health and Wellness Center, and at least 75% of those are women, we've heard these stories over and over again, and we learned years ago that if we simply would balance out women's estrogen and progesterone level, when they get estrogen dominance, we balance the progesterone, that this was really a godsend for women, and it restored them to their youthfulness again. And they felt well, and they weren't having these abnormal cycles and premenstrual symptoms that they had. And so we can save a lot of women from getting into the problem where they end up having a hysterectomy if when you begin to have these symptoms, you begin to replenish that. Also, when a woman has estrogen dominance, when the hormones become imbalanced, that adversely affects your ability to utilize thyroid hormone because you create thyroid binding globulins from your liver. When you have this imbalance that bind onto the thyroid, it can't get into your cells. And in the cells, the thyroid is a spark plug that ignites the power plant that produces electricity. You're not producing any more electricity, and you're fatigued and you've got low energy levels. That is due to hormonal imbalance and decline. And that can be simply replenished with thyroid hormone and with balancing out your female hormones. When you go through the change, of course, you don't make any hormones, and you could replenish your hormones so you don't get the depression and the hot flashes and the mood swings and feeling fatigued and tired and gaining weight and just not enjoying life. This can be easily corrected by replenishing exactly what you made when you were youthful. And it's natural. We only use hormones that are biologically identical in structure chemically to the hormones that your body's made when you were youthful and felt well. So, and by the way, it's not uncommon for young women, when they start their periods and start marching from, age 12, 13, 14 into their 20s, that they have hormonal balances, and this can be caused by diet and getting the wrong chemicals into the body, petrochemicals that can adversely affect the production of your natural hormones. And so oftentimes parents take their little girl who's having a problem with some irregular periods, with mood swings and all that, and they get them on birth control pills, which are counterfeit hormones, which are very dangerous, and in the long term increase the risk of breast cancer. So they get them on these birth control pills, and oftentimes it makes matters worse. It may regulate the period, but their moods are bad or they're depressed because these hormones are counterfeit. They are not biologically the same as the hormones your body make. Why in the world most OB-GYNs don't replenish when women that are younger, instead of putting on birth control pills, put them on natural progesterone to balance out their hormones. We do that commonly in young women, in middle-aged women, and in women that are through the change of life. That can be a huge benefit. We also, even in women, as they get older and mature, whether you get in your 30s or 40s, romantic moods and inclinations may decline, and oftentimes do. And women make testosterone. Nothing to the extent men do, of course, but the testosterone is made and secreted right at the time a woman ovulates, because that's when she, for a 2-day to 3-day period, she's fertile. And so that testosterone increases a woman's romantic inclinations, whereas your husband may seem like an old fuddy-dud. All of a sudden you ovulate and you go like, "Oh, George's looking pretty good to me, honey. Come on over here. Give me a hug and a kiss." And I think God did that to make sure we propagate the race. Otherwise, you may not have any desires after a few years to have those romantic opportunities with your husband. So we also provide women with a little bit of testosterone, very small amount, but it helps with romantic moods and inclination, helps with bone mass, and helps with red cell production. Also, progesterone is very important for bone strength. Women, as they mature, get osteoporosis more commonly than men, but as men's testosterone levels fall, they get osteoporosis as well. And the female hormone progesterone, which is very similar in structure to testosterone, stimulates bone formation. And that's important. And so we've corrected women who have had osteopenia, which is mild bone loss, and osteoporosis. We've seen that corrected with natural hormone supplementation. We also recommend a good healthy eating program. We recommend thyroid when indicated, and oftentimes it is indicated because the thyroid hormones adversely affected by hormonal imbalance and by other conditions, as well as replenishing the sex hormones and vitamin and mineral supplementation, as well as exercise. If you got allergies, we also treat for allergies, airborne allergies. So if you're experiencing these problems of aging and you don't know what's causing them, why don't you go to our website, hotzehwc.com, and read about it. We've got great information on there that helps explain this. Do your own research. Or get a copy of my book. Let me show you here. Hormones, Health, and Happiness. This is my opus work. Call up our office, 281-698-8698, and say, "I heard Dr. Hotze talk about hormonal decline and imbalance, and I'd like a copy of his book." I'll send it to you. Free of charge. We'll ship it to you. I want you to have this so you can educate yourself about natural bioidentical hormone replacement therapy. I want to thank you for giving me an opportunity to be with you today, and please don't hesitate to give us a call. We have a ministry of health here. Our goal is to help each one of our guests get on a path of health and wellness naturally so you have energy and vitality and enthusiasm for life as you age, and we'd love to partner with you. We don't believe you're sick because you have low levels of pharmaceutical drugs in your body. We believe that your symptoms, we got to go with the underlying cause, and it's not caused by low levels of drugs. It's caused by a decline in your hormones, improper nutrients in your body, poor eating habits, low testosterone, and we can help correct that and help you feel youthful and rejuvenated. So give us a call. Thanks so much for joining us today.
Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.